So for our final speaker for today, we have Mr. Chong. So Mr. Chong will give us a talk entitled Healthcare Access, Railways Telepharmacy, and Advanced Medication Dispensing and Delivery Solutions. A bit of background for Mr. J. He's the pharmacist in charge of Railway Pharmacy, which is the first e-pharmacy in Singapore. He believes in the future of healthcare lies in amalgamation of the digital innovation and human touch. Mr. Chong leads a multidisciplinary health tech team pioneering in digital telepharmacy and digital innovation and human touch. Mr. Chong leads a multidisciplinary health tech team pioneering in digital pharmacy practices and advises medical innovators in harnessing Web 3.0 potentials to enhance patient care. He also propagates his passion in professional advocacy by serving as Chapter Secretary of Pharmaceutical Society of Singapore and the Ambassador of Asian Young Pharmacists Group. I present to you, Mr. J.
Hi. So, good evening, everyone. I'll try to keep my talk short because I know I'm between you guys and the door. So, briefly, I'm Jay. I'm the pharmacist that's in charge of Wellbeing Pharmacy. So today I'll be giving a short sharing on our telepharmacy and how we are supporting SATA CommHealth as well as our primary care partners in medication delivery services. So, I think most of us here would know now that we are living in the Web 2.0 era. So essentially, what that means that most people, including our patients, our doctors, as well as our migrant worker population, expect instantaneous connectivity, cloud-based interactivity, and location-agnostic accessibility to healthcare. So, a little bit of statistics-wise, in Singapore, there's a mobile penetration rate of about 165%. So that means that most people own at least one cell phone, or one mobile device, one laptop, etc. And in terms of digital care, digital health, there has been an increase in e-prescriptions for about more than 90% over the past few years. And that means that there's a need for a new concept of pharmaceutical supply chain to support the delivery of new telemedicine services, new care models in Singapore. We are talking about fast and reliable supply of products to patients, availability of products and pharmacy services to our patients, as well as accessibility, connectivity, and service availability to provide care. So today, I'll just very briefly touch on a few things regarding virtual pharmacy, procurement in the Web 2.0 era, and next-gen logistics services. So you might be curious, what is virtual pharmacy? So, loosely defined, virtual pharmacy is a combination of digital care as well as digital health. Digital care is about providing remote, on-demand pharmacist consultations, pharmaceutical services over video calls or phone calls. So this would be akin to the telemedicine services that you will see now that's quite prevalent, as well as e-medical advice in terms of email, text messages that's given to patients. So behind the design of digital care services in pharmaceutical care, we look at things like patient journey, hardware compatibility. I won't go too deep into these discussions, but essentially there are quite a lot of considerations that we do, especially in terms of regulations and data confidentiality. So these are the two key components in virtual pharmaceutical care that we maintain at a very high standards for both patients as well as for our migrant workers' care. Digital health, in the other side of the coin, is about providing healthcare services without direct interaction with patients. So those would be your so-called digital tools. And SATA CommHealth has built a very, very nice ecosystem for their patients in terms of an app, in terms of medical information, in terms of video consultations, all in one app. Whereas for our other partners that is not in SATA's ecosystem, there are other solutions that they can provide for e-requests or schedules of services, medical records, articles on health topics, e-shops, as well as online payment for medical bills. That's all built within their own app. So then, let me talk a little bit more about e-prescriptions. So e-prescriptions is actually quite a new concept in Singapore. It only started about 2 years ago when Wellaway was first founded. So e-prescriptions, what it means is that traditionally, for doctors to be able to prescribe items that they are not dispensing in their own inventory, they have to write hard copy prescriptions. I think most of you here will be familiar with the piece of paper that the doctor have to write the drugs, have to sign it off. But we have essentially enabled for this to be digitalized into an online platform, both on a desktop as well as a mobile, to serve a larger population. So now, on a daily basis, our pharmacy deals with between 200 to 300 prescriptions a day. So you cannot imagine 200 and 300 prescriptions in paper coming in to be dispensed by a pharmacy on a daily basis. So we have moved that to an online platform to design a prescriber journey, to design systems where doctors, as prescribers, can have a first glance in terms of product expiry, have a pharmacist review behind these electronic prescriptions, cybersecurity, as well as patient data. So Wellaway is all about being an e-pharmacy. So we are the first e-pharmacy that's registered under HSA, and we have started operations since 2021. So as a retail pharmacy, we are licensed to dispense e-prescriptions, so digital prescriptions. We are also licensed, additionally, to provide direct-to-home medication delivery services, as well as telepharmacy, whereby patients are able to communicate with us through video calls, through phone calls, for consultation with a pharmacist. So a little bit about the patient's journey on Wellaway Pharmacy, where the patient first has a teleconsultation or a physical consultation with their doctors. The doctors will then e-prescribe on our platform, be it if it's an integrated manner, like what is on SATA's app, or through an online web portal, which I'll briefly show later. The pharmacy staff then, of course, prepares medication, does the medication delivery, and we have a robust supply chain to ensure that there's additional verification of patients' details before the parcels are handed over to patients, and then our pharmacy staff then provides medication counseling for these patients through telepharmacy. So this entire service chain is enabled with a 365 days online system. We have same-day delivery services for our patients, meaning patients can expect to receive medicines on the same day itself and even within 3 hours of their medicines being ordered by their doctors, with temperature controls in place, as well as cold chain delivery of parcels. For example, your injections, your eye drops, that needs to be refrigerated. Those are all managed by us. And as mentioned, 2FA verifications for our users. So Wellaway is not really exactly the same as your retail pharmacy that you see outside, because for us, the prescription is sent to the pharmacy and remote dispensing is done. And whereas on the bottom end, what happens is that the clinic bills the patients directly. So essentially, the clinic is still the one that's seen as providing the care to the patients, that's providing the medication services to the patients, while our pharmacy powers the clinic back end on the services, on the remote dispensing and medication delivery. So at this juncture, let me give a quick demo on how our system works. So 1 second while I walk to the computer. Okay, I will just speak with my voice if you can hear me. So this is actually our online ordering platform for, yeah, I'm trying to commit to it. Yep, so as you can see, this is as mentioned, there's a 2FA verifications in terms of platform usage-wise. This is to ensure that only doctors are able to access our system, because of course, we are only allowing doctors to prescribe on an electronic prescribing platform. Can I get this away? Yep, So this is a platform where the doctors will keep a database of their patients that's available. You will see most of these here are test patients because it's my dummy account. And they are, of course, able to add new patients into this portal. And once they've selected the patient, they will go in to prescribe for the patients. And this works very similarly to like a Google platform. So, you search for your common medication, like, for example, metformin. And the doctor is able to see the various metformin drugs that's available, the various combination products, the various brands of the products, various strengths also. So, and as you can see, the pricings here are actually rather, I would say they are inexpensive, because these are actually wholesale prices that we are actually able to offer to our users. So for doctors, they will perhaps prescribe 30 tablets of metformin, amend the directions of use, perhaps for this to be 2 times a day, and add it to the prescription. So, and of course, for most patients, they will require more than one medication. So let's say if the patient requires Crestor 28 tablets, which is a full box. And you will have noticed that this is also a platform where the doctors can see the pack size of the items and also the expiry date of the items that is available for them. So they'll add to the prescriptions all these items. And once they submit the prescription, it leads them to a prescription summary as a confirmation page to show the items that they have ordered. And at the bottom, this is confirmation, and that's about it. So this is the whole prescribing cycle that is on our electronic prescribing platform. As you can see, they were putting measures to for the doctors to have more clarity on the drugs that they are prescribing in terms of exactly what will be dispensed to the patients. Let me then go back. Okay. Yep. So as mentioned, how we are helping a lot of our partners is that clinics are saving on cost. So in terms of for SATA CommHealth wise, they are saving quite a lot of money in terms of manpower resources in the pharmacy fulfillment process. Instead of having the own clinic's manpower, the own clinic's inventory, the own clinic's logistics services to do the fulfillment for the patients, we are actually helping with that process. We are able to free up manpower in terms of healthcare resources and also provide better pharmaceutical care for the patients. And a little bit more about what we are doing in terms of a purchasing experience in the Web 2.0 era. So most people here will probably be familiar with the likes of Shopee, Lazada, online shopping experiences, shopping on your mobile phone. So, and then the question that we have raised is that why can't we bring this similar experience into the healthcare space, which is why we have a platform also called POM. It's called prescription-only medicines, a term that some of you all might be familiar with. So POM is a platform which allows doctors to order medications directly for their own clinic use through an online portal similar to Shopee. So similarly, in the design of this portal, we have went through the prescriber's journey, commercial models, and also system integrations with our partners. So a sneak peek into what POM is like is there are 3 main factors that this ecosystem is built on. So a pull factor, which is a simple showcase of the products being available, as well as mix and matching, free shipping kind of mechanics. Facilitation of processes of with item descriptions, with product recommendations, product categories, and matching the doctors to the products that they are looking for through smart search, as well as similar product recommendations to the doctors. So this helps in the whole purchasing and logistics process in our healthcare provision to patients. And last but not least is about future-ready pharmacy logistics. So we have heard Dr. Aizat mention just now that there's quite a bit of challenges in terms of getting the medications to the patients, whereby we deal with things like patient wrong addresses, patients being not at home, difficulties of reaching the patients while our drivers are at the doorstep. So with this, next-gen logistics services, we actually build up, firstly, an inventory of more than 3,000 items that's available for prescribing for any doctor from anywhere. Service confidence, whereby we have a robust supply chain with an algorithm, actually, behind the scenes that helps to map how we can get the medications to the patients on the fastest possible way. Product confidence, of course, with validated suppliers, only validated suppliers that we are purchasing from, as well as quality assurance, whereby our whole warehouse and our whole operations is under GDP and GDP MDS certified warehousing and logistics processes. So this is how we are ensuring that despite the heavy load of telemedicine, despite the large volumes of patients that we're expecting, we can keep to the highest standards in terms of medications, in terms of products that's being delivered to them, both in terms of drugs, in terms of pharmaceutical, medical supplies, as well as medical devices that we are providing to these patients. So, and as mentioned, we are also compliant to the Singapore Standards Council guidelines. So if those of you who are not very familiar with this, Singapore has a guideline called SS644, Singapore Standard 644, which is a guidance on medication delivery itself. So, I mean, ideally, all so-called healthcare partners that is providing medication deliveries to their patients need to be compliant to this guideline to fulfill HACSA requirements. So, and similarly, we have HSA audited services, which allows us to provide within 3 hours medication deliveries. So, at the time where the doctors place their order, the patient can expect the medicine to reach their doorstep within 3 hours, as well as next day delivery that's done by our in-house trained fleet as well as audited contractors. So how does this end-to-end process work? Is that at the pharmacy stage, there is a two-party signed parcel handover from our pharmacy staff to our delivery staff. Then at the doorstep of the patients, there's an additional 2FA verification where what happens is that the patients pre-receive a code, a sort of 5-digit code that's from us, where the drivers will then verify this 5-digit code with the patients before handing over the parcels to the patients. So this ensures that there's almost zero chance that the parcel will go to the wrong place. And at the end, there's also a post-delivery verification where there's a photo and signed proof of delivery, and every single one of the photo and signed proof of delivery is verified by our pharmacy staff before this entire process is closed off as dispensed to the patient. Yep. So what we ensure is that once the order is placed, this order will definitely reach the correct patient with the correct drugs at the correct time. So as part of curating the omni-pharmacy experience for patients, we have also in place secured video calls for our patients, whereby they will consult us in terms of drug interactions, in terms of medication dosages, medication side effects, so they are able to have a direct line to the pharmacist. They are able to have HSA licensed protocols, as mentioned, in terms of telepharmacy for medication counseling, patient education. We are also able to help with simple patient triage for the patients, as well as supply pharmacy-only medicines, which is regulated by law to allow our pharmacy to supply. And of course, we do have professional pharmacists who are able to run a little bit more complex medication management clinics, health coaching services, as well as simple motivational counseling that we give to patients for those, especially those that's trying to quit smoking, or those that's having some emotional issues. So that's the health coaching services that we have in place. So overall, the omni-channel patient experience that we have curated is both an online to offline as well as an offline to online patient conversion. For the pharmacy to be integrated into the entire ecosystem, including NEHR, our National Electronic Health Records, as well as our clinic management systems, clinic management softwares. So for the likes of SATA, SATA system is actually clinic assist system is directly integrated with our pharmacy, meaning that whatever prescriptions that happen within the SATA prescriber's interface, it gets fired over directly to the pharmacy and no additional maneuvers are needed. Accessibility, where patients can access care either through a telemedicine app or the pharmacy app. And for patients to be able to receive medications anytime, anywhere. So that's the end of my sharing today, and I'll be happy to entertain any questions. Thank you.
So I would like to open the floor for any questions from the audience. Okay, I have a question for you, Jay. Okay, what is the difference between the prescription for Wellbeing Pharmacy and the prescription that we printed online with the digital signature? Because I was told that that will not be accepted by the pharmacy.
Yeah. So in Singapore, at least in terms of legal regulations-wise, electronic signatures on prescriptions or PDF prescriptions are not allowed by law because of the risk of sort of duplicated copies. So meaning if the patients copy and paste your PDF 10 times, they get 10 times the supply of the medications. Yeah, so and it's for that reason that this is not allowed. So in terms of e-pharmacy processes, what is required is a closed loop process whereby we build in system that to ensure that this prescription is only fulfilled once, all the way from the prescribing stage to the dispensing stage, and it's impossible for it to be duplicated. Yeah, so that's the main difference and that's the main reason why this sort of PDF signatures are not allowed in Singapore. In the future, it might change if we move into probably blockchain technology, where if you put up a prescription on the blockchain, then it becomes immutable, it can't be changed. But at least at the current stage, this requirement for a closed-loop prescribing system is the sort of the definitive requirement for e-prescriptions.
All right, thank you very much. Okay, I think we'd like to.
Thank you. Thank you.
Thank you very much, Mr. J, for the very eye-opening potential for telepharmacy. Okay, so I think with that, that's the last talk for today. I would like to ask the audience to, if possible, to scan the QR code for feedback and leave us some feedback here. And for doctors here, we can scan the QR code for the CME for this afternoon. Okay, so I think that marks the end of our journey for today. Thank you very much to all speakers, and thank you very much to all for attending these sessions. Thank you.